Hi all, we are going to discuss about novel drug delivery systems. Novel drug delivery system is a specialized approach that uses advanced formulations and technologies to transport pharmaceutical compounds in the body. So as the name indicates, these are newer technologies which has the ability to modify the transport, modify the drug release, and modify the action. Before going to discuss detail about the um, novel drug delivery system, first we can see, let's see what are the disadvantages of a conventional system. The major problem is the reduced potency because of partial degradation. The drug may undergo phosphorus metabolism, and because of that, it may get its bioavailability may get reduced. Then toxic levels of administration, sometimes excess dose administration may happen. Then increase of cost associated with excess dosing. That is another disadvantage of conventional system. Then sometimes due to administration pain, the patient complaints may less. That is also a disadvantage of conventional system. So when we design a newer system, the goals may be set according to the disadvantage or by considering the disadvantages of the conventional system. So in case of novel systems, it deliver exactly to a target site to limit side effects. Then it distribute drugs through specific areas of the body without degradation, maintain a therapeutic drug level for prolonged period of time. That means it will help to achieve the controlled drug delivery. Then predictable controllable release rate, reduce dosing frequency, so increase the patient compliance. So all the disadvantages what we discussed in the conventional system is being rectified by the it can be rectified by the novel regulatory system. So there is another concept like sustained versus controlled release. So sustained release means these are the pharmaceutical dosage form formulated to retard the release of a therapeutic agent such that its appearance in the systemic circulation is just delayed or long. So in case of sustained release system, it is just delaying the drug release, not in a controlled manner, but it just delay the drug release. But in case of controlled release, it has a predictable drug delivery uh, range. That means per hour it will release this much of drug. That kind of calculation of that kind of prediction we have, or the drug formulation is designed like that. That will be easily understand by the you will get an understanding about by this graph. We can see there are three type of drug release patterns. The first one is this. Uh, Here, the drug, once we administer the drug, first we swallow the drug, it will go into the intestine, there it will disintegrate, then dissolve. So after convert into the solution form, it starts to absorb. So the availability, bioavailability in each interval, each time interval is plotted here. So first, it will reach into a specific concentration, which is known as minimum effective concentration. There, the drug starts to produce the action, and then it reaches into the minimum safe concentration. Beyond this point, the uh, drug may produce the toxic effect. So at a certain point, it starts the bioavailability or the amount of plasma drug concentration starts to decline. Then it reaches into again at the minimum effective time. So at this point, we have to add the another dose, the second dose. Then again, it will perform the therapeutic action. After some time, it will start to decline and reaches into the uh, or minimum effective concentration. There we are the third dose. So likewise, in a conventional system, we have to add the dose once the plasma concentration decreases beyond minimum effective concentration. In case of sustained drug delivery system, we can prolong the drug delivery. So the actually our goal is to maintain the drug release or the plasma drug concentration in a therapeutic range. This range, the concentration between the minimum effective concentration and minimum safe concentration is known as therapeutic range. So the our aim is or our goal is to maintain this drug concentration within this therapeutic range. So uh, for that, we have two approaches: sustained release or controlled release. So in case of sustained release, it only just sustain the drug release. So it will we get some more time in a therapeutic range. But in case of controlled release, this is the controlled release form of zero order. Here, the drug reaches uh, very fastly into the therapeutic range. Then once it achieves the therapeutic range, uh, the drug is released from the pharmaceutical formulation in a controlled manner to maintain this range. It will not decline, it will not go up, but at a specific period of time, it will release the drug and it will add into the formulation. Then the plasma drug concentration will be steady for a long period of time. So that is known as controlled drug release system. So no controlled release system is known as it's a part of novel drug delivery. So most of the novel drug delivery systems are focusing on to achieve this controlled drug delivery. So the advantages, as we discussed previously, the total dose is low. It has very reduced side effect, GI side effects, because it releases only very small amount of drug at a period of time. Then reducing dosing frequency, better patient acceptance, so patient compliance will be high. Then less fluctuation at plasma drug level, more uniform drug effect, improved efficacy or safety ratio. Uh, it has some disadvantages also, mainly dose dumping. So every period of time, each time interval, a certain amount of drug is releasing. So there may be a chance of this dose dumping if it is not utilized properly in the body. Then reduce potential for accurate dose adjustment is another disadvantage. Then need of additional patient education. Uh, we have to uh, we have to counsel the patient how to take the drug. Sometimes it may be film coated. So in that instance, they should not break the tablet. Sometimes the patient should be more conscious about the um, hypoglycemic incidence in case of anti-diabetic patients. So a lot of patient education is required about its use and monitoring himself or herself. Then stability problems, because it is novel that there are a lot of sophisticated technologies are utilized for the preparation. It is very complicated. So the stability issues may happen, especially in case of nanoparticles. Then as it uses a lot of sophisticated technology, the cost of production may be high. So the ultimately the entire formulation may be available at high cost. That is another disadvantage. Then coming to the classification of drug delivery system, there are four types of controlled drug delivery systems: right pre-programmed drug delivery system, activation modulated drug delivery system, then feedback regulated and site targeting drug delivery system. So first one is rate pre-programmed. As the name indicates, the rate of the drug delivery is pre-programmed. That is what we call rate pre-programmed. It is again three types: polymer membrane permeation control drug delivery system, polymer matrix diffusion control system, then micro reservoir partition control drug delivery system. So the polymer membrane permeation control drug delivery system, a drug formulation is totally or partially encapsulated within a drug reservoir compartment, and the drug release surface is covered by a rate controlling polymeric membrane. So as the name indicates, there is a polymeric membrane which is covered or which is encapsulate the entire drug formulation. So the drug has to pass through this polymeric membrane to get released. So that will act as a rate controlling barrier. So the polymeric membrane can be fabricated from a non-porous or a non-porous membrane, homogeneous or heterogeneous polymeric material. Then examples are progestasert IUD. It is an intrauterine device deliver natural progesterone continuously in the uterine cavity at a daily dose rate of at least 65 mcg per day to achieve contraception for 1 year. So that is the advantage of novel drug delivery system. We can keep the drug at 1 year, 2 year, or more than that, depending on the technology what we use. So the drug reservoir is a suspension. In case of progesterone, the drug reservoir is a suspension of progesterone crystals in silicon medical fluid and is encapsulated in the vertical limb of a T-shaped device, just like copper T, walled by a non-porous membrane of ethylene vinyl acetate copolymer. The second one is Norplant subdermal implant. It releases levonorgestrel at a daily dose rate of 30 mcg to each subject for up to 7 years. Then another example is opposite system. It is applied or installed on the eye. So here we use pilocarpine released at a constant rate of either 20 or 40 mcg per hour for the management of glaucoma for up to 7 days. Then second category is polymer matrix diffusion control drug system. Here, the drug particles are dispersed in a rate controlling polymer matrix. In the previous one, we use the polymeric membrane as a outer barrier. But here, the polymer is incorporated along with the drug particle, and likewise, it controls the drug delivery. So this is a schematic diagram here. The drug is dispersed in the polymeric matrix and there is an eroding surface. It will erode and the drug will release. So it will take time to release the drug. Example, Nitrodrug. So a transdermal delivery system fabricated by first heating an aqueous solution of water-soluble polymer glycerol and vinyl alcohol. Then the temperature of the solution is then gradually lowered and nitroglycerin and lactose are dispersed just above the congealing temperature of the solution. Then the mixture is solidified in a mold. Then it sliced to form a medicated polymer disc. So after assembly onto a drug impermeable metallic plastic laminate, a patch type transdermal system is produced with an adhesive rim surrounding the medicated disc. It is designed for the application onto intact skin for 24 hours to provide a continuous transdermal infusion of nitroglycerin at a dosage rate of 0.5 milligram per centimeter square per day for the treatment of angina pectoris. Then next one is micro reservoir partition control drug delivery system. Here, the drug reservoir is fabricated by micro dispersion of an aqueous suspension of drug using a high energy dispersion technique in a biocompatible polymer, such as silicon elastomers, to inform a homogeneous dispersion of many discrete unleachable microscopic drug reservoir. So the advantage of this or the speciality of this kind of drug delivery system is each drug molecule is encapsulated in a micro reservoir. In the previous one, it is the old formulation is considered as a drug reservoir, but here each drug molecule is encapsulated in a micro reservoir. Example is NitroDisc. It is also used for the treatment of angina pectoris. This is a transdermal system which provides administration of nitroglycerin at a daily dosage of 0.5 mg per centimeter square for once a day medication of angina pectoris. So here, this is the drug molecule encapsulated in a polymer. Then activation modulated drug delivery system. In this kind of system, the drug delivery is mainly regulated by or initiated by some kind of activation. That activations may be physical, chemical, or biochemical. So physical means again different types are there: osmotic pressure activated, hydrodynamic pressure, vapor pressure, mechanically activated, magnetically, sonophoresis, iontophoresis, hydration. Then in chemical means it is pH activated, ion activated, hydrolysis activated. Then in case biochemical means enzyme activated, biochemical activated. So let's see each in detail. First one, physically activated regulatory system. In physical activated, the major physical activated systems are osmotic pressure activated. Here, the drug release is initiated by or because of initiated because of the osmotic pressure. Here we use a drug reservoir, a semi-permeable membrane that separates the drug reservoir from the environment, and an osmotic agent. So these are the major ingredients of or the major components of this kind of drug delivery system. So here the drug is placed here in the drug chamber. Then it is covered with a semi-permeable membrane, which contains a so an osmotic agent. So sorry, in the on the outside it contains an osmotic agent, and there is a semi-permeable membrane. So what happens here is that it will absorb the fluid, and it will allow permeate the fluid inside. Then when the fluid mix with the osmotic agent, it will swell. It will produce the osmotic pressure, and because of the pressure, the drug reservoir will squeeze and it will release the drug through this orifice. So this is what happening in the osmotic pressure activated drug delivery system. Then in case of hydrodynamic activated drug delivery system, here the fluid flow trigger the drug release. So this is a collapsible drug container, and there is a swellable hydrophilic layer laminate. So when the GA fluid enter into the drug reservoir, uh, the absorbent absorb the fluid, and it will swell, just like what we see in the osmotic pressure um, drug delivery system. Here also it will swell, and because of the swelling, the liquid formulation will be ejected through the drug delivery orifice. The next is vapor pressure activated drug delivery system. Here there are a lot of bellows. So what happens is that it contains a vaporizable fluid chamber. So here the fluid will be vaporized when it has a contact with the atmospheric temperature. So when we apply the drug formulation or install the drug formulation in the body, then the vaporizable fluid gets vaporized, and the vapor will touch the bellows, and these bellows are flexible, and it contains the drug which is to be released. So the bellows will move due to the vapor pressure, and through the drug outlet it will be ejected. Then mechanically activated drug delivery system. In the mechanically activated system, the physically we have to apply pressure by hand, just like the what we used in the canisters, or the rotahealer, that kind of equipments. Uh, in this specific case, the metered dose inhaler, the aerosol is placed in the canister. There is a metering valve and a placing holder, then a propellant, everything is there. So when we apply the pressure, it will release the aerosol through the outlet. Then next is magnetically activated drug delivery system. Here uh, the drugs which is having the magnetic action is placed in a or it is not necessary that the drug should have the magnetic action, but some magnetic material is incorporated along with the drug. Then outside there is then after this, after incorporating it with the magnetic particle, the drug delivery system is installed in the installed or implanted in the body. Then from outside we can give or we can place one magnetic ring because of the attraction of this magnetic materials, the drug may get released. So this is magnetically activated drug release. Then next is sonophoresis activated release. Here we use ultrasonic energy to activate the drug delivery system. Then so this is the explanation or demonstration of the drug release by sonophoresis. So here, this is the drug barrier, that is skin. Then the drug reservoir is placed here. Then when we apply the ultrasonic vibrations, it will permeate through the skin membrane and it will reaches into the uh, veins or the arteries which is placed or capillary network which is there in the uh, deep skin parts. The next is ionophores activated nervous system. So here the drugs or as you know drugs are weakly acidic or weakly basic. They have their own charges. So we utilize that behavior. Opposite particles will attract. So we apply the cathode and the anode in various places, and because of the attraction of the positive and negative ion, that may get attracted or retarded, and based on that, the drug will be released. Then feedback regulated drug system. Here again, three types are there: bioerosion, bioresponsive, and self-regulating. So in case of bioerosion, the drug release the bioerosion the um, it consists of a matrix or scaffold. The systems typically consist of a matrix or scaffold made of biodegradable polymers or other material which gradually degrade or erode in response to the surrounding environment. So when it contacts the surrounding environment, the outer polymer matrix may degrade or disperse. So that may initiate the drug release. So the system consisted of drug dispersed biodegradable matrix fabricated from polyvinyl methyl ether ester, which is coated with a layer of immobilized urease. So at neutral pH, the polymer only erodes very slowly. Urease enzyme metabolizes urea to form ammonia, and this causes increase in pH, rapid degradation of polymer with release of drug molecule. So this is the demonstration here. Urease is immobilized with the hydrocortisone. When it produces the ammonia, it will the pH will change and it will initiate the drug release or the hydrocortisone release. Then bioresponsive system. Here, the drug is enclosed in a bioresponsive polymeric membrane whose drug permeability is controlled by concentration of biochemical agent. So the examples are glucose regulated insulin delivery system. The next is self-regulating drug delivery system. Here, a complex of glycosylated insulin concavalin is encapsulated inside a polymeric membrane. Glucose enters into the system and it activates the release of glycosylated insulin from the complex for controlled delivery out of system. The next one is site targeting drug delivery system. Here, the drug is released only at the target site. So these are several type of site targeted system. There are different types of site targeted drug delivery system, including liposomes, nanoparticles, microspheres, and hydrogel. So these systems can be designed to target specific cells or tissues, such as cancer cells, and can be engineered to release drugs over an extended period of time. So that is about the different novel drug delivery approaches. Thank you.